Hello everyone, we're your pharmacists from Primeah Pharmacy. In a bid to celebrate the World Hepatitis Day, we are here to educate you about hepatitis. This year's World Hepatitis Day theme is Hepatitis Can't Wait. Did you know that about 2 people die every minute from a hepatitis-related illness, and there are about 15 million people currently living with hepatitis B infection in Nigeria. Hence, we can't wait to act on hepatitis.
So what is hepatitis? Hepatitis is the inflammation of the liver, that is the swelling of the liver. It is most often caused by viral infections, although it can also be caused by toxic exposure, that is exposure to harmful substances, and autoimmune, that is the body fighting itself.
So what are the types of hepatitis? There are 3 major types of hepatitis. We have the viral hepatitis, the toxic hepatitis, and autoimmune hepatitis. So viral hepatitis can be caused by 5 types of viruses: hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus, with A, B, and C being the most common. Hepatitis A virus is transmitted via the fecal-oral route, that is, through the ingestion of food or water that has been contaminated by bits of fecal matter from an infected person due to poor hygiene. Hepatitis B virus is gotten via blood, infected blood, through sexual contact, or can be transmitted from a mother to her child during childbirth. Hepatitis C virus is also gotten from infected blood or other bodily fluids. For example, somebody has a needle stick injury from a needle that has the infected blood. The person can have hepatitis C virus. Hepatitis D virus is gotten via infected blood, but it's important to note that hepatitis D infection only occurs in people that already have hepatitis B infection, because hepatitis D cannot survive without the presence of hepatitis. Lastly, hepatitis E virus or hepatitis E infection, like hepatitis A, can be gotten from contaminated food or water, and this is found mostly in areas of poor sanitation. So second type of hepatitis, the toxic hepatitis, is gotten via exposure to toxins like alcohol and drugs. Alcohol directly damages the cells of the liver, and this can eventually lead to liver failure. Other toxic causes include overuse or overexposure to drugs. Drugs as common as normal paracetamol, when abused or overused, can lead to hepatitis. Then the autoimmune hepatitis, like my colleague said, is when the body attacks its own liver.
So who are the people at risk? Number 1, people who work in the hospital because they are exposed to the blood of someone infected with hepatitis. Drug users who share needles and sharp objects. Excessive consumption of alcohol can also predispose one to hepatitis. Poor sanitation and nutrition can also expose one to hepatitis, so practice good hygiene. Multiple sexual partners can also predispose one to hepatitis.
What are the symptoms of hepatitis? Some people are asymptomatic, that is, they do not manifest symptoms. But for those who develop symptoms, the most common symptoms are flu-like symptoms, including nausea and vomiting, fever, aching abdomen, loss of appetite. Less common symptoms include dark urine, light clay-colored stools, and jaundice, which is yellowing of the skin or the white part of the eye. The signs of hepatitis, which confirm hepatitis, are lab tests, liver function tests, which reveal elevated liver enzymes or the presence of the virus.
How do we go about the treatment and vaccination of hepatitis? So if you know that you have hepatitis, there are treatments available for that, and so make sure to go to the hospital to see an healthcare professional for that. If you are not sure if you have hepatitis or not, or whether you have been exposed to someone who has hepatitis, then get tested. The good thing is that we have vaccines against hepatitis A and hepatitis B. Then get vaccinated. Remember, preventive care is the best form of healthcare.
To mark the World Hepatitis Day, Primeah Pharmacy is reaching out to you. We'll be conducting free hepatitis tests, offering vaccines at an affordable cost, and we'll be here to answer any questions that you might have relating to hepatitis. We want you all to make yourself available for this, because hepatitis can't wait. We'll be communicating the date and time to you very soon.